we had a short transmission from the conference hall after the theoretical part, and taking into account the results, half of the participants are accepted for the second stage, which is practical part.
Okay. That's today. That's today, right?
That's today. That is going to happen now. In a few minutes, we're going to start. And so the first task will be microanastomosis. Okay. So the group of 22 best students is split into two subgroups, 11 in each.
Oh, okay.
We're going to have 11 students, and we have 11 working stations.
Oh, so the sound is excellent. Now, when you use that mic, it's excellent.
Oh, good. So I will use it this way.
It's excellent. Yeah.
So, and we can show the overview of the whole laboratory. Now you can see the working station of the instructor.
Okay, so we're going to be following the. Okay, so we're going to be following the station there, following the students doing their skills, correct?
Right, right. And it will be also possible to transmit from the microscope if needed. So we can do it.
Yeah, can we test that, please?
Pardon?
Can we test that?
Yes.
The view from the microscope?
Yeah, we can test that. А можно попробовать изображение с микроскопа? Вот он хочет очень, когда будет все происходить с микроскопа. То есть он хочет с общего вида переключиться на микроскоп, вот там, где анастомоз происходит.
Ну, на микроскоп.
Сейчас общий вид пола показывает.
Просто был заранее конкурс на крысе со свидетельством анастомоз. Сейчас говорят на крысе, да? На крылышке. Там просто совсем другая анатомия, и консистенция сосуда другая. Просто мы готовили совсем другому. В смысле, на крысах? Да. На крысах мы оставили участников, да, если будут какие-то спорные вопросы. Тогда будет на крысах что дополнительное. Будет дополнительно, если потребуется. Первый этап — это крылышко, более простое. Сейчас вам покажут. Ну, анатомия все тоже демонстрирует, да? Там просто консистенция другая, она же уже не способна.
Yes.
We should communicate during the transmission, but not by speaking, because I don't want to interrupt. So is there a way I can text you? Do you use Google Chat or Facebook? Do you know what I mean?
We're using the chat, which is here, group chat. Can you hear? I sent you a message.
Okay, let me see. Okay, you can see.
So
okay,
check,
okay. Oh, good. Okay, good. Yeah, I see. That's how we'll communicate. Because obviously, I don't want to interrupt by saying, "Hey, I can't hear," or "The sound is not good." You know what I mean?
Yep.
So
I will be near the monitor and I will see the chat.
Okay. I'll post messages here.
So could you test, please? If you send me the message, yeah, I got it.
Yeah.
Good.
So basically,
all the technical issues, yeah.
Right. If there's a technical issue, that's where I'll post it. And if there's one that you have, you can post it too. Yeah, yes. I see the video screen is very good. Yeah, well, you can see it actually yourself too, right?
Yeah, but now it's just the floor, right?
Right.
So, and it's not on yet. So we are going to switch on when it is, yeah, when it starts, right?
Can we test it before, like a simulated, like
the microphone, the microscope? You can see the microscope as well, right?
Yeah.
Да, но надо кого-то посадить туда, чтобы видно было. Экран? А, может быть, кого-то посадить не туда, на то рабочее место, чтобы видно было.
Перекусик.
А вдруг он же сейчас все отвалится?
Так я специально, чтобы не отвалилось. Вы дернете, оно...
А, понятно. So, now we're going to put, yeah. Can you see the chicken wing?
Yes, I can.
Good.
Makes me hungry.
So the first step is to perform microanastomosis, microsutures on the chicken wing.
Right. Okay.
So now the students have arrived and they're going to take their places.
Okay. Yeah, are you going to commentate during the proceedings? So you'll be
Yep.
telling us what's happening?
Yeah, and we will turn the camera so that you could see different views. And if it is interesting, so, I could invite someone for a short interview to share their emotions or to share their opinions or ideas.
Yeah,
What do you think? Is it a good idea?
Yeah, just like television, Aaliyah. Just whatever you think would make it interesting, just do it.
Great. So
We can do whatever we want.
when we start the transmission, shall I explain again what is happening here?
Yes, that would be nice to the people
Yeah,
that are watching. Because we're live now. We're live right now. People are watching us right now.
Already?
Yeah, so don't swear.
Okay.
Don't
Okay.
swear.
So maybe we'll change the view of the room. So I have already actually introduced the event. We call it Neurosurgical Olympics.
Oh,
And
cool.
it is the first and it is the first event happening here, so it is our first experience.
Oh, wow. Very good.
And totally we had 45 participants the first day, and now we have 22 participants for the second stage, which is practical part at the laboratory.
Right. Well, that's an excellent picture, and if you explain what they're doing, I don't know if you.
Yeah. So now
do you know neurosurgery well or no?
Well, I know it's a bit. I'm not a medical person, but I work here in the hospital, and I'm a research assistant. So.
Yeah, for example, now you could say they're just dissecting the tissue, they're retracting.
Yeah, we'll comment. Make comments.
You just comment whatever's happening and whatever's relevant, whatever you think.
Good. So now the participants are taking their places. So we have 11 working stations here in the cadaver laboratory.
Are we going to get to meet the participants face to face?
I can, well, let me manage the camera.
You know, that would be nice if you could put them on a camera and say, "This is Sergey. He's from Moscow, and he." I'd like to introduce him, and he could say, "Hi, how are you?" Whatever, if you want, just like we can do whatever we want, Aaliyah.
Now we're trying to turn the camera so that you could see not only the floor that you can see, right?
Yeah, just like the television.
We will manage
okay, just another. If you think another view of outside, watching them move their hands from.
So now we will introduce some of the participants.
Yeah.
Какие ноги-то? Я микроскоп.
Вот, эта камера, чтобы было лицо видно. Сейчас.
So can you see the general view?
Yeah, no, right now I can see the view of the chicken.
The view of the chicken. So now we'll change. Сделайте нам Мне нужно, чтобы здесь был кто-то постоянно прекращать.
Oh, there. Now I see.
So, Dr. Bennett?
Yeah, now I see the general view. Yes.
Great. So we are in the laboratory. You can see the general view and some of the participants. Here you can see the participant from Tyumen, Ivan. And maybe some words. Иван?
Okay, go ahead.
Может быть, несколько слов вообще об ощущениях со вчерашнего дня. So Ivan is going to share his emotions, his opinion of the first day, and his anticipations.
That's great.
Вчера все прошло отлично, но тесты были очень сложными на самом деле.
So the tests were very difficult yesterday. Theory.
Мне они дались очень тяжело, но.
And it took great effort to complete all the tests.
Но благодаря другим тестам я попал сюда и прошел отбор, и сейчас.
But finally, I managed to get to the second stage. I was accepted for the practical part.
Okay, Leah, can we have his name and where he's from, where his name and where he's from?
From Tyumen. This is the student from Tyumen Medical Academy, Tyumen Medical University.
What's his name?
The final year. His name is Ivan. The fifth year. Sorry, the fifth year. So one more year is left, and his name is Ivan.
Okay. Very good.
he would like to be a neurosurgeon, certainly.
Okay, very good. Thank you. 5
So,
years.
and we also have people from all over the country. We have some participants from Krasnoyarsk, which is the eastern part of Russia. We have some from St. Petersburg, and some from Belarus, Republic of Belarus, Grodno.
Wow, that's great.
And
Can we meet? Can we?
also
Can
from
we meet
Greece.
them? Can we meet them?
Yes, sure. So
Yeah,
they're
let's
taking
meet
their
them.
place.
Let's meet them all, and they can say hi to the folks at home.
Okay, so let's try. They're taking their place, but I will try to get them here around.
Yeah, that would be nice to meet them.
Так, уважаемые участники, все расселись, мы все рассадили.
Just a second, I will try to get them here before they
sure.
start.
Well, yeah,
Because after they start, it will be difficult.
Don't make it too difficult for them. If you can, that's fine.
Сейчас, если можно, всех пригласить так, чтобы видно было в камеру, чтобы они помахали, представились. Потому что сейчас идет трансляция, онлайн-трансляция. Нет, вот тех, кто сидит, те, кто основные участники, пригласить их сюда, чтобы на камеру можно было. So they're going to come here so that you could see all of them, all our participants of the first group.
Oh, great, great. Okay. And if we could introduce them all when they do that.
Вот сюда поближе подойдите, пожалуйста. Да? Камера, вы видите камеру. Профессор Беннет, вы видите. So,
Hello.
Dr. Bennett, are you there?
Yes, yes, I am.
I cannot see you. Okay.
Yes. Hello.
Вот туда посмотрите, пожалуйста, на камеру. Поздравляйте с доктором
Hello.
Беннетом.
Welcome.
The hot welcome from cold Siberia.
Can we meet each one of them, please? The first name.
Буквально пару слов. Откуда вы?
Красноярск.
Ижевск.
Бурятия.
Урал. Екатеринбург. Бурятия.
Тюмень.
Morocco.
Okay.
So you can see we have participants from all over Russia and even from abroad.
Excellent. Excellent.
So let's wish them good luck.
Yes. Well, good luck, everyone.
And now the most serious part starts. They're
Okay.
taking their places and
Okay.
they're going to have assistants as well
Okay.
as real neurosurgeons.
Oh, okay. They have like a surgical nurse.
Yeah, right. They're going to have a team.
Oh, excellent. Excellent.
And so the first task is to perform microanastomosis on a chicken wing.
Okay.
And so the first task is to suture the nerve. On the instructor's working station, you will see our neurosurgeon of the vascular department, Yegor Markin, who is going to show the suture, and the task for the participants will be to make the same kind of suture.
The same that Victor does.
So suturing the nerve.
Okay.
So can you see
Yes,
the whole view, or?
Yeah, I can see Victor,
Yeah,
correct? Is that
Victor?
Victor?
Right, right.
Okay.
So the requirements are being announced.
Okay. Can you explain what the
So this is
requirements
it.
are? We can't hear.
So
Aaliyah, just explain what the
So
requirements are.
Alexander is explaining how they're going to estimate the results,
Okay.
the quality of the suture,
Okay.
the ability to manipulate the correct way with the microscope.
Okay.
Yeah, I have to leave the microphone for a while. Let
Okay.
us have just the general view, because I will have to explain the assignment to our foreign participant.
Okay.
I will
Very
be back
good.
in a second.
Okay. Very good.
Сейчас смотрите, как все будет происходить. У нас есть главный монитор. главный экран, который выводит с преподавательского микроскопа изображение. Сейчас Егор Сергеевич вам расскажет, что вы должны сделать, как вы это должны сделать. Только участники, чтобы вы друг другу не мешали, подходите ближе к этому монитору, слушайте Егора Сергеевича, и потом рассаживаемся по местам, после чего по общей команде, когда я скажу, мы засекаем время, потому что мы на время работаем, и вы будете приступать к работе. Все услышали? Хорошо. Итак, те участники, которые сидят за столами, пожалуйста, подойдите к преподавательскому столу. Егор, вы готовы?
Если все видят, что у каждого свой монитор. Каждый час. Без сейчас.
Добра. Это где? Добра.
Сейчас, подожди.
Да. Молодец. Он отвалился?
So, Dr. Bennett?
Yes.
So now you can see. Microscope on me. So can you see the microscope or the general view now?
I have the general view now.
Now we're going to transfer it to the microscope.
Excellent.
Our instructor, the vascular neurosurgeon, shows the way the nerve has to be exposed,
Okay.
the way the incision has to be done, and the way it has to be sutured.
Excellent.
So all the participants are around the table watching carefully, and then they have to repeat.
Okay. Can we see the view?
We also, yeah, can you see that?
Yeah, can we see the view from the microscope or no?
This is the view of the microscope. Can you see the view of the microscope?
No, I see the view of Victor doing from a general view, but not a microscope view.
We also have a 3D monitor where the students can see the depth using the 3D glasses.
Beautiful.
Can you see that?
Yes, we can see the microscope view.
Good.
And if you could translate when he explains, is he explaining in Russian or English?
He's not explaining, in fact, he's just showing.
Okay, I see.
So the
Okay.
excision.
I see. So he's showing us the nerve that he wants to dissect, correct?
So they have, the participants have to make the same step by step.
Okay.
First, expose the nerve.
Okay.
You make the cut, and there are several criteria to estimate the quality of the work, which
Okay.
is timing, perfect timing. They will have 15 minutes for exposing the nerve.
Okay.
Then the incision has to be even,
Okay.
very straight. Then the quality of the suture itself will be estimated.
Okay.
Good fixation of nerve.
So each of the students' work will be reviewed by someone judging?
Yes, there is a judge board,
Okay.
and they're going to estimate each student's work, and we're going to show you the working stations as well, so that you could see how the students are working.
Okay.
The suture has to be even, without any tearing of the nerve or
Okay.
exceeding tension.
So are they
also-
cutting the nerve completely and re-anastomosing? Is that what they're doing?
Right.
Okay.
Всем, друзья, все готовы?
So you can see it on the microscope view now, right?
Yes.
So the suturing the nerve, the
Okay.
first which is necessary, is to fix the wing correctly.
Okay.
So this is the shoulder.
Okay.
Here you make the incision.
Okay.
Here this incision had already been done,
Okay.
and participants can use either scissors or a scalpel to make the incision. And here in this fissure, they will find the nerve and expose it.
Okay.
So we enter the muscle, inside the muscle, and the first that you can see is the nerve. So
Okay.
here
Okay. I
is
see the
the
nerve
only
now.
nerve that is necessary to expose and suture.
Okay, that's the nerve in question, right? That they have to expose.
Right, right.
Okay.
So there are two parts, two lines. So you have to cut it, and the line has to be very straight.
Okay.
So you can use a scalpel or scissors. It's up to you. And after that, you use the pad
Okay.
to simplify the task so that it could be exposed and seen very well. There can be different ways. You can choose your way of suturing. It depends on your skills. So here in the sample, you can see that the nerve has already been it has already been cut, so it is impossible to connect two ends. But in the real sample, they will have the possibility to connect two ends, right? So it has to lie down very evenly without turning, without exceeding tension. It's not important how many sutures you have. As a rule, it is needed to make four sutures. That's enough. So don't try to make as many as you can, right? Perineurally. This. So this is the first stage, first task. And you have 15 minutes to complete the task. So they have sutures. The question is what size?
Уважаемые участники, инструктаж проведен. Присаживайтесь, пожалуйста, на свои места, те, кто делает. Пока еще мы время не засекаем. Рассаживаемся, берем своих ассистентов.
So we're using 9-0 or 10-0 Eticon sutures.
Small sutures.
Yeah, yeah, yeah. You can start now. If you need me, I will. Yeah. I think so. Андрей Михайлович,
Уважаемые участники, был вопрос по поводу, где взять инструменты.
So Professor Sufyanov.
Там вы можете посмотреть, что...
А вот свободное место, Саша, можно поменять. Сделайте общий. Now we're going to show the general view, and Professor Sufyanov has just arrived.
Okay.
Рассаживаемся участники, кто сейчас будет работать. Когда будет дана общая команда, будет засечено время. У вас на месте
So you can see Professor Fianov
40
here.
минут.
Just a second.
Не более 15 минут на выделение нерва. По истечении 15 минут мы будем оценивать, кто как его выделил, чтобы присудить балл.
So Dr. Bennett, Professor Fianov is here.
Hi to everybody. Один, это ниже.
Hello, Dr. Sufinov. How are you?
Здесь, да?
Yeah.
Hi to everybody. I am fine.
Yeah.
We start the next step of our competition for the students, and we yesterday we finished the theoretical course, and 20 participants choose by the score for the next step. And now we start next step. Next step is first is nerve suturing, then vascular anastomosis, then drilling, and so on. And after we complete all sets, we estimate the participants. Now the leading students is from the Krasnodar. Перечислено. Ага. Okay. Yeah. Okay. Okay. This is a very great event for us. And I hope for the next conference, all the students around the world come here to Tyumen and take part in this great event.
Oh, great. This is the first year, Doctor, you've done this?
Yeah.
The first year you've done this? This is the first year you've
Yeah, this is the first time. This is the first time in the Russia, and I think first time in the world.
Wow.
Because I never seen before.
Wow.
Here before about this. So I welcome for the next year.
Excellent.
All students from the world. Welcome.
Excellent. Thank you.
Now we already have some students from abroad.
Okay.
One from Greece, one from Morocco. So we can call the event international. And from some former republics of Soviet Union, which is Belarus.
Okay.
So we're going to show you how the students are working.
Okay.
So now the camera is targeted at one of the participants.
Okay.
Can you see the working station well?
Yes, we can see. No, we can see
Our instructor, Yegor.
We can see Victor there.
Yeah. So now you can see one of the working stations. Participants are getting ready.
Are they getting? Are they given a time limit, Alaya, or do they?
For the first step, they have 15 minutes. So they need to expose the nerve.
Okay.
And cut the nerve.
Okay, in 15 minutes.
In 15 minutes, right.
And each student is being evaluated by a judge.
Yeah, and the board is from Federal Center of Neurosurgery.
They're from Tyumen.
They're observing each working station, each student, estimating the quality of work, the quality of incision, the quality of suture. And they work in teams. Some of them are individual participants, and most of them are team participants.
Okay.
But there is a main, so-called main surgeon and assistants. We also have a TV company from Tyumen here, and now they.
Yeah, it's a TV company from Tyumen. From Tyumen.
Pardon?
Where's that TV crew from?
Shall we show? We will show you the TV crew.
Yeah, where are they from?
They are from Tyumen. It's
Okay.
local television.
Okay. Yeah.
Yeah, we'll see.
You can tell people that they can watch this live on neurosurgical.tv if they want to see it.
I have already announced, and they're very curious and anticipating to
Yeah,
see
all this is being televised live. And you can hear our voices too, actually, live.
So this event is very important, not only for Federal Center of Neurosurgery, but for Tyumen on the whole and for the region. And the event is greatly supported by the governor of the Tyumen region. And the main prize that the participants are going to get, 3 best participants are going to get a free place in the residency.
Wow.
In the chair of neurosurgery of the first medical university in Russia, which is the best. And Federal Center of Neurosurgery is a clinical base for that chair of neurosurgery. Professor Sufyanov is the head of the chair and the head of Federal Center of Neurosurgery.
Okay.
So the residents, some interference, sorry, and the residents are going to study here in Tyumen using all the facilities of the Federal Center of Neurosurgery, observe all kinds of surgeries possible in neurosurgery, in modern neurosurgery. We have 5 departments, which is pediatric department, vascular department, tumor, spine, and functional neurosurgery department. So the center itself serves the whole country. And patients from all over the country and even from abroad come for the surgeries here.
Okay.
And we have 90 beds only for neurosurgery.
Okay.
No trauma cases, only elective cases.
Elective.
The most only elective cases, and all most difficult cases are operated here.
Okay. Vascular tumors, that kind of case.
Right, spine, pediatric. So we have the biggest pediatric department in not only in Russia but even beyond.
Okay.
And in general, we have almost 4,000 surgeries per year, which is a great number. And a lot of surgeries are done endoscopically, so they're minimally invasive. One of the targets, one of the main tasks is to perform minimally invasive surgeries using high technologies.
Okay.
And the residents will have the perfect chance to study here.
Now,
So
tell me about the equipment that they have. I know that they have a hybrid MRI. Could you tell us a little bit about the equipment that Tyumen has that's unusual?
So for now, the main pride of the center is the hybrid intellectual interoperation CT operative room.
Okay.
With where all the equipment is interconnected. We have endoscopic stand. We have Toshiba CT with the biggest gantry, which enables the surgeons to work with the patients in different positions, supine or even semi-seated. So it gives more opportunities. And intraoperatively, they can use CT to make sure that the tumor is removed completely before the closing the wound. So it gives the guarantee of the surgery. And we have brain lab connected, the microscope, which is card-size microscope, pneuma arm, so it is equipped with state-of-art equipment, so to say. In general, we have 7 operative rooms.
7, okay.
7 operative rooms.
Okay.
And as for ICU, there are only 12 beds, but take into account that most of the surgeries are minimally invasive. Patients don't spend much time here in the hospital. That's why it is possible to make almost 4,000 surgeries per year.
Okay. And you say the referral base is mostly Russia, most of the area around Tyumen, or is it all of Russia that they get patients from?
All over Russia, and even some from abroad. So we have a lot of patients from Kazakhstan, for example, which is the neighboring republic,
Right.
former republic of the USSR, now a country.
Okay.
And we have a common border with the Tyumen region. That's why it's not a big distance. Sometimes we get patients from Mongolia, and it makes it Trans-Siberian Railway makes it more convenient for them to travel because they can use the train, direct train from Ulaanbaatar to Tyumen, and they don't need to change, which is sometimes one of the main factors of choosing the hospital.
Okay.
And of course, we perform about half of the surgeries for the citizens of Tyumen and Tyumen region.
Okay.
So the participants are starting. They have prepared their working stations, their working places, the field, and now the timing is going to be on.
Okay.
Can you see the general view now?
Yes.
Yeah. So
we can see Victor overseeing things.
Last preparatory steps, and we're almost starting.
Okay.
And one of the advantages of studying here is to have the possibility to participate or to be the audience of international conferences, which we have a lot.
Right.
So a lot of international hands-on courses are held here. Skull-based courses, one is the main actually event, which occurs annually. We also have hands-on courses in microvascular surgery, in spine surgery.
Okay. Well, let me tell you, Leah, one of the advantages, of course, is the hands-on experience.
So now we're studying, and I cannot hear you very well.
Yes, I can hear you.
So now it's a very serious moment.
Okay.
The students are going to start, and the timing. Yes, so they start. They have 15 minutes for the first step.
Okay.
So we will show you one of the stations, one of the participants. Владимир, на одного из студентов наведите с камерой. Кого-то. Мы ориентируемся на эту камеру, да?
Okay, well, on that screen there, we see a view of one of the students' surgical fields, correct? So each surgical field's in front of the student there that shows what they're doing?
Right. Now you can see.
So
Yeah,
each microscope has a camera, has a screen that shows what they're doing.
Exactly. And each working station has a 3D monitor with excellent quality.
Wow. So the judge can see exactly what they're doing
Right.
from the microscope.
Right. The judge doesn't need to look into the ocular, so it is possible to use the big monitor.
Right. Excellent. Excellent.
That makes the result more objective.
Right. Right.
So now on the monitor, you can see one of the participants forming the incision.
It's a good picture. It's excellent sound, Aliyah.
Thank you. Now we have 11 participants. It is half of the group, of the total group.
Okay.
So this contest is going to be repeated for the second group. And after that, they will estimate and compare the results. And another stage will be drilling. They will be using lamb heads
Oh, that'll be interesting watching that.
It's going to be, for you, it's going to be tomorrow, in fact, because it's going to be about 4 to 5 p.m. So maybe it would be possible to switch on again, to get connected.
Yeah, we can televise whatever you want.
Just to have complete information, complete picture, the best picture of the event which is going on. And those participants who were not accepted for the second step, for the second round, are watching and listening to the lectures in the conference hall now. They also have the possibility to see the live surgery, which is going to be transmitted in the afternoon from one of the ORs. So they're not losing their time. They're learning.
No, I see students walking around with iPads. They are also tuned in to Neurosurgical TV, or are they watching the microscope view?
They're watching microscope view and they're recording.
Oh, really? Wow.
These are assistants.
Okay.
They can also use this material for studying, for improving their skills, and just to have it as a memory.
Okay. I'm also taking pictures, Aliyah, and posting on social media.
Oh, great.
Yeah.
Are you going to post them on the same website or somewhere on Facebook?
I post them on Facebook, Google Plus, LinkedIn, and Twitter. See, what I'll do is I'll take this picture now and say this is live from Tyumen at Neurosurgical TV, you know, like a commercial type of thing.
Oh, great. So, thank you, Dr. Bennett. We appreciate it very much.
Yeah. Well, it's good to use the technology to...
And it would be good to widespread this this videos, probably this information, so that the students from all over the world could participate next year. So it wasn't announced very widely this year because it's the first time, but we hope that it's not the last time. It's just the first time, just the beginning. So all the students from any country are welcome. And any students, regardless of the origin or language, can get the chance to study here in the chair of neurosurgery in the residency of First Moscow State Medical University. At the base, at the venue of Tyumen Federal Center of Neurosurgery. So now you can see that the nerve is almost exposed, sorry.
You still there? Okay.
I'm here. I'm here.
Okay.
So.
That's good.
So maybe we could make a pause here. Maybe we could stop here and show the results. Or
yeah, sure.
What do you think is better?
Hold on. Have you ever heard of Neurosurgery Cocktail? It's a very big neurosurgery group on Facebook. I'm posting it right now.
Great, thank you.
Yeah. Just it's a little trick I learned. But they've got 16,000 people that like neurosurgery. that participate pretty frequently.
Oh, that's great. Thank you.
So I'm sure they have some live from Tyumen Neurosurgery Olympics testing skills of neurosurgical residents. If you get Facebook, you can look it up. You can see it.
But well,
Okay.
if you send me the link, I would be really grateful.
Yeah. Okay. Okay. I'll send you the link right now, and you can see what
I will
exactly.
share the link with all the participants so that they could
Yeah.
see,
Yeah, they could.
find themselves.
You know, I bet you the neurosurgical residents, they know about uh, this group in Facebook. It's a very popular educational group in Facebook. Now, I don't know how many Russian neurosurgeons use it, but I know some do.
We will definitely announce it. And those who don't know about this resource yet, they will join for sure.
Yeah, they can see it on Facebook on Neurosurgery Cocktail, and I'm going to write that in my email to you right now.
Great. Thank you very much, Dr. Bennett.
Yeah, sure.
Now you can see one of our residents. Controlling and observing the station, judging. So we have several judges. So, Dr. Bennett, shall we leave the whole event online? I mean, the whole competition, or we could stop here and then get back.
No, we'll just leave it going. It's no big deal. We'll just let it go. You don't have to, announce during the whole thing. But it's just going to be on this particular part. It's just 15 minutes, right?
Yeah.
That's not long. That's not long. And now, do they judge the people? I see that gentleman exposing the nerve. Do they see after this 15 minutes? Do they judge each one individually and tell the person right then, or how is it done?
They're going to record the points and explain if necessary, but this is just one step, 15, which needs 15 minutes. Just exposing the nerve. The next step will be to cut the nerve and to suture the nerve, and each step will be judged. And for
well, I'd like to see each step because they're all vital parts of being a neurosurgeon.
Yeah.
So all vital skills that are important for neurosurgery.
We'll go on with transmission.
Now, I think this is interesting for people that are watching because they normally don't televise the neurosurgery skill competition.
If somebody of the audience has any questions, we will gladly answer any.
Okay.
Please.
I'll mention that. Yeah, I'll mention that right now. Anybody has a question, just go to the Facebook page of Neurosurgical TV and just write down the question. Because right now I'm also televising on Facebook Live.
Oh.
I'm just televising me, actually, Aaliyah, not you, but myself, behind the camera, like behind the scenes. I have a camera on me now.
Unfortunately, we cannot see you here.
Yeah, no, this is extra. This is extra. If you have a smartphone, you could see on my Facebook page, you could see me behind the scenes. I'm just, you just see me in my study. Yeah. Oh, there's someone that shared a post there. Yeah, they just shared it. Yeah. Gentleman, Vakatesh Midjaluru, he's a neurosurgeon. Oh, he's from the Ukraine, Oblast, Ukraine. I believe he's watching now from the Ukraine.
Good, great.
Yeah.
So if there are any questions that occur, we will gladly answer any.
Okay.
And you can share the contacts so that they could
Okay.
contact offline. So we are absolutely open. Anyone is welcome, and they can start preparing for the next competition, which is going to happen next year. Now they know how the competition is going on. For the participants of this year, it must have been really tough because it was absolutely new. They've never tried anything like that. And the questions in theoretical part were rather difficult, so there were several parts. For neurosurgical terminology, it was a multiple choice test, and then neuroanatomy test, they had to indicate and to name the structure which was on the screen, which was pictured on the screen. And they also have some assignments to decipher MRI and CT scans.
Okay.
And also English. So they had listening comprehension test, reading comprehension, and vocabulary test.
Okay.
Because it's becoming more and more important for the doctors and neurosurgeons particularly.
Oh, really?
People to communicate.
Okay.
If you want to be in the World Neurosurgical Society, if you want to get updated, if you want to follow the modern trends,
Right.
You need to speak English. You need to read a lot.
Okay.
So this is one of
another skill.
One of the skills that are necessary to have. So you see this participant has already very skillfully exposed the necessary nerve using the pad now.
Уважаемые участники, прошло первые 15 минут. Сейчас проверяющий проверит, как вы видели предмет, чтобы поставить балл.
Now the judge announces the timing. 15 minutes have passed. And this is the first stage.
И останавливаемся. Выделили нерв, шьем, пересекаем и шьем. Все пройдет 40 минут.
They have 40 minutes to complete the task. So now the participants are not going to stop. They're going on. They cut the nerve and they have to suture.
Oh, okay. They have to cut the nerve and resuture it, right?
And resuture it, right. Yeah, exactly. So now we can see it online, how it's happening.
Okay.
And meanwhile, the judge is walking around and estimates the result at this point.
Right. See, that's Victor, right?
So,
right there.
Yeah. So now we can see another screen. Another working station. This is the participant from Morocco.
Morocco, okay. Let me get a good picture of Victor.
So another working station, the lady.
Okay, where's she from?
I don't know exactly,
Okay.
but not Tyumen.
Okay.
So the geography is really very, very wide. We have people from the west of Russia, from the east of Russia, from Belarus, Grodno, from the south of Russia, and from the north of Russia. So
Okay.
from all over. So you can see another working station here. It will be also estimated how well the participants can manipulate the microscope.
Okay. Yeah, as you know, a large part of neurosurgical works under the microscope now, as you know.
Yeah, right. They're using searches 90, 10.
The highest I ever got was 60. That was for facial injuries. And those were considered small.
Yeah. So here is Alexander. He's the judge, the main judge.
Hi,
And
Alexander, I have a few questions to ask Alexander.
Yeah, I'm listening.
Yeah, what kind of skills are you looking for in the resident in these type of procedures? What are you looking for?
Well, looking for when I check in the students.
Yes.
Well, looking how they work with the microscope, with the microseizures, and all instruments. How
they expose the nerve, how
expose, yeah,
exposure.
Yeah, and of course we have enough time, 40 minutes for all these preparations.
Okay.
And this we grading with some bells.
Okay.
40 minutes, one ball, right walk with instruments and microscope, and with your operation for one ball. And of course, when they using monofilament and where they cut in the nerve, we checking how they for 0, 1, 2, 3, or 4 balls we can get them.
Okay. Okay.
And 20 minutes yet they have also 20 minutes, and and I say that the end first.
Right.
The first step in our, because on the next step they must to make anastomosis.
Anastomosis. Okay.
Yeah. Yeah.
Okay. So you're simulating live neurosurgery. You're showing the same kind of skills that a neurosurgeon must have in the operating room. Right.
Can you repeat, please?
No, well, yeah, you're showing the same skills that you have to have as a neurosurgeon.
Yeah, definitely.
Yeah,
Right.
yeah.
They're acting like really almost like live surgery. Те же навыки должны использоваться, да?
Yes, of course, we're using the skills in our operation rooms. Well, it's basis.
Basic,
Oh,
basic.
yes, it's basic.
Right,
You must to know this basic
right.
at first, and then you can work with real surgery.
Right, right.
That's why Professor Sofyanov considers his mission to conduct cadaver courses.
Okay,
So it is necessary to train. And we have a vet lab with lab rats, so it's possible to train microanastomosis skills. And we
okay,
also have skull-based courses with heads. And
okay,
we use lamb heads for craniosynostosis courses, for example, to learn drilling. So
okay,
all possible cadavers are used. Full body
okay,
cadavers are used for spine courses.
okay. So
Here you can get all this.
you have other cadaver courses that you offer.
Right, right.
Okay.
And all our residents use these courses at first, and only then we can work with the people.
As a neurosurgeon, did you take many cadaver courses during your residency? Does a resident take these courses?
Now, this preparation, not. I'm first year resident in our center, and we work on the nerves and mechanismosis
with the rats.
and another time.
So it is possible for the residents to use the cadaver laboratory whenever they want, actually. When they're free, the laboratory is accessible 24/7, so to say. So anytime.
Anytime, and every day we work at this laboratory. But when we get students from our country, we do not work with him. We judge him.
Okay.
And during the cadaver courses, our residents help the conductors. So they assist, they organize everything.
Okay.
They don't, sometimes they participate if there is a chance, but most time they are needed as assistants.
Okay.
They usually not occupy the working stations, but they see the whole process.
Okay. Very
And
good.
after that, they can use their manual skills. They can try.
Okay, right now, Aliyah, are they reanastomosing the nerve? The students are?
Yeah, now you can see that. Now, so you have the view of one of the working stations, right? And the general view, and you can see that they're using searchers. They're researching the nerve.
Okay. That would be nice if we could get a view of that, of a student attempting to reanastomose the nerve, and I can get a picture of that. That'd be nice.
We'll try to get a picture. Just a second.
Yeah, of a student trying to reanastomose the nerve. That would be nice.
Рабочую станцию одну нужно показать прям целиком. Было бы хорошо, если бы вот эта часть.
Yeah, that's good. That's a great view. Right there is excellent. Okay.
So, yeah, one of the views. But here,
he's exposing the nerve.
It's just exposing. Yeah.
Yeah.
We will try to find the participant who is performing reanastomosis.
Right. That person is exposing the nerve. Correct. Oh, there we go. There we go. There's one reanastomosing. Okay. I see it. Okay, there we go. Okay, I took a picture of that.
So this is the second step, reanastomosis. The quality of the suture will be estimated. And also it is important not to have the nerve torn or damaged. There must be no tension, no twisting. Just like in a real surgery.
Okay.
Most of the students are final year students. Some of them are doing the 5th year. Some of them are doing the 4th year, so they have different skills, different level. But those who are in the middle of their studies, they have the chance to participate next year.
So those are medical students, correct?
Those are all medical students from different medical universities from all over Russia, from St. Petersburg, from Krasnoyarsk, which is the eastern part, eastern Siberia, from the south, and also from Tyumen. Students from Tyumen Medical University have the chance to attend all the courses that we have, at least the theoretical part, because it is the entrance is free of charge. So anyone who is interested can listen to the lectures in the conference hall and see the live surgeries. So this is a great opportunity for them.
Mm-hmm.
Now they have 10 more minutes to complete reanastomosis.
Патрон, есть еще шовный материал? Человек может шов сделать. И главное минус в основании. Не время идет. Шовный материал, будьте, пожалуйста, поаккуратнее.
Как одна девочка.
So now I'm just looking at the list of participants.
Okay.
For the practical part, and we have 4 ladies, which actually is not very often in Russia. I mean, neurosurgeons are usually men because it's really a tough job.
Well, that small suture, Aliyah. Have you worked with? You don't work in neurosurgery, right?
No, I'm not.
Okay. You done any suturing? Have you done any suturing, Aliyah?
I've never tried.
Okay.
Just watching.
Okay. Well, those are very
some
thin
theory.
sutures. Those are very thin sutures.
Okay.
I mean, so delicate. They're so easy to break.
Right.
And because I had so
one
much
needle was broken, and one of the participants broke the needle, so they're replacing
right.
suture. Which
Well, you know, one thing I noticed because I did some hand surgery, and they also do some work under the microscope with hand surgery, and they advise you not even to drink coffee because your mild tremors, you may not see it normally, but you will under the microscope. You'll see your hand shaking just from drinking coffee. Of course.
For me, as far as I'm not a medical person, not a neurosurgeon, it is. It looks magic. It's absolutely unexplainable how it is possible to have hands so steady.
Such a delicate skill.
Yeah, very delicate skill.
See that gentleman suturing the
So the ends are very short.
Осталось 5 минут.
5 minutes are left until the end.
going in for another suture.
Yeah.
Wow, such delicate. Oh man.
Dr. Bennett, 5 minutes and we're over.
Wow.
Oh.
There we go. He's got that suture in there, it looks like. Now he's got to manipulate grasping the needle and now doing a surgical tie, an instrument tie. I don't know what if there's a name for this particular type of instrument tie. You know what an instrument tie is, correct, Leah?
I can find out. Frankly,
that's what they do when they use the actual instrument. They wrap it around that twice and then pull the knot.
Yeah. So they're using microsurgical forceps.
Right, forceps. Right.
They
wrap the suture.
Grasp the suture and to make it to tie.
Right.
Make a knot.
Make a knot. Yeah, they wrap it around the forceps and then pull it.
And also some tricks exist how to make it easier, and Professor Takizawa from Japan conducted courses, hands-on courses in microanastomosis several times already in Tyumen in Federal Center of Neurosurgery, and he's going to be here in May again, and he taught a lot of participants from all over Russia.
Really?
Special tricks in special microsurgical microanastomosis tricks.
Maybe we can televise that.
Yeah, we could do that.
Yes.
So the course is going to be on in May.
Okay.
And all the courses are announced on our website.
Okay.
Just a second, I will be back.
Четыре, три, два, один. Инструменты на стол. Инструменты на стол. Все инструменты положите на стол. Из рук, в руках уже ничего быть не должно. Сейчас ваш результат наш проверяющий проверит.
So the time is over, and you can see the participant who is finalizing the searches. We will show you the overview.
Okay.
They're finishing their job,
Или дождаться проверяющего, он проверит надежность вашего шва.
and now they're going to be checked and estimated. The quality of the searcher, the quality of the nerve.
Okay.
It has to be without any tension, no tearing, no twisting.
Okay.
Начинаем проверять сначала. Понятно, закончили. Все закончили, демухлюем. У всех одинаковое время.
So the participants have to stop now. And our residents will estimate the quality, give the scores. the conditions are really tough for the participants because they are only students. They're not practicing neurosurgeons yet.
Right. So the students are pretty sure they want to go into neurosurgery, correct?
Yeah, right.
Most of them are pretty decided they want to do neurosurgery, Aaliyah?
Pardon?
Most of the students are sure they want to go into neurosurgery?
Well, at this stage they are, but most of them have still have 1 year ahead or 2 years ahead.
Well, you know, every country's different.
But they're very motivated.
Right.
Yeah, in our country, we have 6 years of medical university and then 2 years of residency, which is much less than in other countries.
Okay, well, most students, some take an internship because they're not decided on what career they want, and then they'll decide during internship what specialty they want to go into. Now, I don't know if that is like Russia, or you have to decide during medical school if you're going to do a neurosurgical residency. How does that work? Do you know?
Well, they have 2 years of residency,
Okay.
but they do only very simple surgeries. They are not allowed to do surgeries. They just assist, and they learn, and they work as consulting neurosurgeons first. And it depends actually on the place. Sometimes after completing residency, they start making surgeries in hospitals. But probably the system will change a little bit, and we'll have longer residency because 2 years really is not enough. So you need to study really hard, and that's why our residents spend all their time here. They have no free time, absolutely. So they try to use all the day, all 24 hours for studying. So it's more concentrated.
Okay.
Because in some countries, you need to complete 4 years of residency or 5 years of residency to become a neurosurgeon. In our country, it's just 2 years. So you have to work harder. It's more concentrated in time. It's shorter. And you have to have the same skills because the surgeon is going to operate on a live being.
Right.
So it's more responsibility. So now the judges are estimating the quality of the suture, and there is another group waiting outside. They will be let in several minutes.
Okay.
And they will perform the same. And after that, there will be a short break, and at about 4 p.m. or 4:30, they will start the second task, which is drilling. They will be using lamp heads for that.
Okay.
So, and drilling skills will be estimated.
Okay.
Craniotomy.
That's another skill a neurosurgeon has to use. Correct?
Right, exactly. So probably we could stop here or wait until the results are announced, and then get back to the broadcasting at 4 p.m. Tyumen time. What do you think, Dr. Bennett?
Okay, well, okay. Could you explain what's going to happen in the next couple of hours?
Now they're going to change groups.
Okay,
and the first group,
they do essentially the same thing that we just saw, correct?
Exactly. And the first group is going to proceed watching the lectures, which are on in our conference hall, and there will be live surgery transmitted as well. So it's not losing time. They will learn.
Okay, what happens at 4 o'clock?
Pardon, I didn't get you.
What happens at 4 o'clock?
The second assignment, the second contest, the second hands-on contest is going to take place here in the same laboratory, but it's going to be a drilling contest.
Oh, okay. So why don't we
Using
pick
the
up?
ram head.
Yeah, we can pick up again at that time if you want.
Good, if it's possible for you, because it's nighttime.
No, that's
Your
okay.
place.
No, that's okay. I don't have any time. This is
Good.
my training. I'm not a neurosurgeon, but I'm a televising person, and you have to do all kinds of hours. I don't have to sew with 9/0.
So we can get back at 4 p.m. then. And meanwhile, you can have some rest.
So
hopefully you will be able to have some rest.
Yeah.
And-
No, I'll have some rest, and I'll see you.
And thank you very much for being with us.
Okay, I'll see you at 4 p.m. Tyumen time.
See you, Dr. Bennett.
Thank you.
Thank you. Thank you for being with
Glad
us.
to see you.
Bye-bye. Thank you.
Bye-bye.
Thank you.
Thank you.